Hi everyone, welcome to the first episode of the series of Thriving Families. This is going to be a bi-monthly series of speaker sessions where I will host some local and outside of the Northeast Florida region health providers in different aspects of women's and children's health, anything from chiropractors to nutritionists to mental health, doulas, birth workers, a little bit of everything just to bring you some education and some ideas and some tips on how to manage motherhood, fatherhood, parenting in general, pregnancy, postpartum, all things health and wellness surrounding those main topics. As you know, I'm Dr. Padilla with Thrive Family Chiropractic. I am a mobile chiropractor in the Northeast Florida area, and my focus is mostly pediatric and children's health, but I see families for wellness care as well. And today, I'm very excited to start the speaker series with Maria Inoa. She is a licensed clinical social worker, and she owns Full Potential Counseling, which is based out of Jacksonville, Florida. So Maria is going to talk to us today about some tips for mental health wellness during pregnancy. Thank you for being here, Maria.
Oh my gosh, thank you so much for having me, Dr. Padilla. It's my honor, of course, always. But yeah, so we're talking about, pregnancy and sort of some mental health tips to help take care of yourself during that time. And so I have a few tips I share with Dr. Padilla and I talked about, but the first one is to decide what kind of birth you want, which sounds kind of maybe like duh, but honestly, to sort of decide, like kind of that birth plan idea, but what you want, what you would like your birth to be. It doesn't always go that way. You have to be flexible, but like, what do you want to happen before, during, and after that is most comfortable to you and follows, is in line with like your beliefs and everything like that. So that would be the first one. The second one, and actually it's kind of, I'm going to jump around because I don't have it listed this way, but the second one that kind of matches that, the first one is consider hiring a doula. Especially depending on what kind of birth you want. If you're someone who isn't really concerned about whether it's a C-section and, you don't really, it doesn't really bother you, you're kind of up for whatever, don't have a lot of preferences, then you're probably, okay. But a lot of women do have preferences and things that they would prefer to happen. And so having a doula there is having that support person, of course, that's outside of a family member that knows the whole ins and outs of the birth process and the labor process, that can stand in, because a lot of times our significant others don't want to stand up to the medical professionals, the nurses and the doctors. It's very intimidating, of course, but that doula is going to stand up to them and let them know, if you don't want such and such and they're trying to do such and such, the doula will be there to say, no, she doesn't want that, and to prevent that from happening. So a doula, that's definitely something that I wish I had. I think it's like they're worth their weight in gold. So that's my second tip. My third one is to try to build your support group now. So to try to get locked into the different moms groups that are available online, and also like different groups. There's so many different ones that meet up at different times. Some are more geared towards walking with strollers and exercising, but there's so many good ones. And if you wait till after you've had the child, you're going to be very possibly just super tired and not have that extra energy to put into doing that. So if you use that time during your pregnancy to sort of try to connect with people, other mothers that are due around your time, then it will be just much easier that when you need the support, once you've had the child, then you can just reach out, and you're already sort of connected or have an idea. So the fourth one is to, and this kind of goes back to the hospital, is to not expect the hospital staff to read your mind or to know what you want. This was an eye-opener for me because I just thought that they were just like, ooh, birth, just, so happy and positive and like loving. And so I was really like shocked that that's not how they are. Can you not hear me? Okay, I can hear you. Can you hear me?
Okay. Yes, perfect.
Okay. You want me to go back or just keep going?
You were covering the fourth one, and you said that that was an eye-opener for you, as far as the staff in the hospital reading your mind.
Yeah, I just think that when you go in, again, this kind of goes back to what do you want during your birth? What would you like it to look like? What, having a doula possibly as that support person is just not to expect the hospital staff to read your mind or really be concerned, because what I had to learn was that they're basically there to keep you and your baby alive, which obviously is super important. But the other things that are super important to you may not be, and probably is not a priority to most of the staff, because again, they want to make sure that you and baby are healthy and everything goes smoothly. The rest of it's sort of like fluff, that's how I say it, to them, but that may be super important to you, right? Like skin to skin seems like an obvious thing.
Yeah,
So,
absolutely. Cord clamping is a big topic on that end too. It's not a standard procedure for hospitals. It is not something they have to do, but there's a lot of women who really want that because there's a lot of research supporting it. And it's not something a hospital will do unless you mention it in your birth plan or you discuss with your provider.
yeah. So, just kind of remembering that. And my last tip is to just sort of honor yourself during your pregnancy. Everybody's pregnancy is different. Some people are very sick. Some people are not sick at all. Sometimes you're in between, but is to not push yourself to do so much if you can help it, to listen to your body when you need to rest. If this is not your first, it's like, okay, well, there's always going to be laundry and things cleaning around the house to do. There's always going to be that stuff. But if you really need to rest, it's like listening to your body and stopping and resting, to remind yourself that you're growing a human inside of you, and that takes a lot of energy from your body. And also in all that too is like, do make sure you're doing things that you enjoy, even if it's something small like watching a TV show that you really love, or a movie, or reading, or just taking like a prenatal yoga class, or things like going to Dr. Padilla, getting adjusted so you feel good, getting the prenatal massages and things like that help you to feel better, that are sort of like a way that you're pouring that love into yourself, and you who are carrying this child, that child will feel that too.
Absolutely. Thank you. I love that. I love the way you mention all these things, and that most of these things that you mention are actually external things, if you will. A lot of people seem to associate anything that's mental health with like talking to someone or like doing like internal work on yourself, which is very important, but there's all these other aspects of mental health that apply to the decisions we make and the things we do for ourselves and the things we plan for our pregnancy and for our family. So I love that you mentioned all those things, like having a support system, like a doula, and reaching out to the community. Like these things definitely come back to help us and help a woman go through all those fears and all that, all those challenges during pregnancy and postpartum. So it's definitely really important to have that community outreach as well, and find that your like tribe, your mom group that is gonna help you, that you realize that you're not the only person going through this stuff, that it's very much normal to feel some of these things that they are feeling, and that it's okay to talk to other women or to your doula or to a counselor about these things as well.
Yeah, definitely.
Yeah. So I have a question for you. When you work with these women, if it's through pregnancy or postpartum, are these some of the things that they mostly come to you with, fears and challenges, or are these things that you normally find that help you do your work a little bit easier, I guess, or maybe?
I think a lot of women come to me for, especially, because I see mostly women, whether they're pregnant or they're not or what have you, but a lot of like anxiety, a lot of times it's anxiety. Not as often it can be depression, or it's a mix, especially if it's postpartum. I see a mix of that. So, I think it's just depression, anxiety are common, or really honestly commonplace for people. There's usually like it's almost like someone once said, like, it's not whether you're anxious or depressed. It's more like, where are you on the spectrum? Maybe you're super low, maybe you're moderate. It's just common, just in the world we live in. So I think that sometimes we do talk about some of these tips depending on the person, like who it is and what's going on. And if it's like, maybe they had a first birth and it really wasn't what they wanted, and so now they're trying to do things differently. And so we kind of talk through some of the things that help to what we can do, what we can control in terms of like bringing down their anxiety levels, especially.
Yeah, definitely. Great. Well, thank you so much. I think this is very helpful. It's obviously, like I had mentioned before, this is why you're here, because we do a lot of the very similar work.
Yes.
I do get to discuss a little bit of mental health with my patients, because I can tell when they come in, it feeds that anxiety that you were talking about, those fears, all those questions, it feeds into the way their body responds to care. And sometimes I'm doing everything I'm supposed to do, and I see that things are not changing, and then we sit down and talk about these things. And a lot of times it comes down to they have this internal fear, they have these things they want to express and they're not able to, or they don't know where to go for it. So this is why we do the work we do, and we work together very frequently because of this. So
Yes.
yeah, thank you so much. So if people in the Northeast Florida region do want to reach out to you, or actually, I know you do virtual work as well. Do you do work just in Florida, or can you do work outside of Florida?
It's mostly Florida. If it's outside of Florida, I have to look at sort of that state's rules. They're kind of becoming more and more flexible about it, but I do offer virtual. I always had, and then during this time, it's super important, obviously. So I do offer it mainly to people who live in Florida right now, who reside in
Florida. Okay, perfect. Wonderful. Well, thank you so much, Maria. And if you don't mind repeating again your contact info or how people can get a hold of you, I think we briefly lost your audio there.
Okay, sure. So they can go to my website. It's www.fullpotentialcounseling.com. There's a contact form on there. They can also find me on Facebook, Full Potential Counseling Jax, or Instagram, Full Potential Women. But my email is just maria@fullpotentialcounseling.com. So whatever way is easy for people to get a hold of me, they're welcome to, if they have a question or just are looking for services, they're welcome to reach out.
Perfect. Thank you so much. Thank you for taking time to chat with me. It's always great to connect with you. And I hope this was very helpful to anyone who's watching or listening to this. And if you have any questions for either Maria or myself, please reach out. My page is Thrive Family Chiropractic. Or you can reach out by email, is Jax, J-A-X, mobile chiropractor @yahoo.com. So thank you so much for watching. Thank you so much, Maria.
Thank you, Dr. Padilla. I love it. Thank you so much.
Take care.
Bye.